Hello, my name is Dr. Sanjay Patel. I'm a consultant paediatrician from Southampton Children's Hospital. It gives me great pleasure to talk to you about the Healthier Together Urgent Care app. Just going to share my screen. The app was developed about 12 months ago to really support the and build on the Healthier Together program that we've had in place across Hampshire and the Isle of Wight for the past 5 or 6 years. And it is based on the evidence around health-seeking behaviour, with a real attempt to try and influence and inform parental health-seeking behaviour, to try and tackle the ever-rising number of children being brought to primary care and ED with self-limiting common infections and other presentations, whilst trying to identify unwell children in a more timely fashion and get them seen in the right place at the right time. And so we know from the evidence that parents simply seek a healthcare consultation because they are worried that their child might have a serious illness, and they don't feel they have the tools to distinguish a common minor illness, something that will get better by itself, to something that requires some form of specific treatment and may pose a harm to their child. And on the back of this, we have developed all of the red, amber, green resources to give absolute clarity to parents about what things constitute red features, amber features, and green features. And this is a program we've implemented across the urgent care pathway. So from health visitors and midwives through to community pharmacists, primary care professionals, NHS 111 paramedics and NED. And that consistency of messaging is absolutely crucial if we are able to support parental self-confidence. And clearly inconsistent messages will truly erode their self-confidence and will drive future health-seeking behaviour. And through this approach, we've had a significant impact on presentations to primary care. And these are data between 2016 and 2020, prior to the COVID pandemic. And you can see that we've reduced primary care presentations by 10% across Hampshire and the Isle of Wight, purely on the back of providing parents with resources and healthcare professionals with clinical pathways. But what we're keen to do is to try and improve that further. We've seen extraordinary challenges in the past 12 months, 24 months, and we know that through not having seen children being unwell due to the social restrictions in place, parents, any confidence they may have had has been truly eroded, and they're coming to seek consultations at higher rates than ever previously seen. So we've been working on an app which has been co-designed with parents and GPs and piloted within the Sovereign PCN and Ferrum. And what it does is it takes parents systematically through red, amber, green symptoms to allow them to self-triage their child to one of those categories and then receive the required support. And that's really to support their decision making. And it's very different to other forms of electronic consultation platforms, because it's not just a way of communicating directly with primary care. It doesn't offer on all of those pages, click here to send a message to your practice. It very much focuses on those amber children. And I'll show you some of our data in a moment. So what the parent's able to do, and they can do this, for all practices across Hampshire and the Isle of Wight, is they can create a profile for their child that puts in the month and year of their child, which then allows the information that's provided to be age appropriate, as in adapted for the age of their child. So it won't be talking about nappies in a 15-year-old, etc. It's broken down into ages, so automatically, if your child's under 3 months, you'll be shown these resources if you're worried about your child, and if your child's over 3 months, you'll get this concertina of options, ranging from breathing issues to fever to head injuries to sore throat to earache, diarrhea, and vomiting. But the terminology used will be age appropriate because it's been age band adapted. And so they'll be shown red content first, and clearly if their child's got any of these red features, they are advised to seek an urgent consultation in hospital, which may be going straight to ED or calling 999 for an ambulance. If their child's got any amber bullets, and these are completely consistent with the resources on the Healthier Together website, so there is absolutely no inconsistency between the app and the website content, then they will have the option for GP practices that have onboarded to send a consultation directly to the practice, they will be able to identify which features of that presenting complaint their child has, add extra information, and then they'll be informed that that message has been sent to the practice and will be reviewed the same working day. And for children that have no red or amber features, the parent will be led to the green content, which will reassure them that their child doesn't have at that point have a serious illness that requires urgent review, and will be provided with safety netting content, advice about what to do at home, and symptoms and signs to look out for. And this is all based on nudge theory to try and influence parental health seeking behaviour above and beyond just the content of the Healthier Together website. And the key bit is really that option for parents to communicate with the GP practice directly. That makes it highly attractive to use this app because it saves them calling the GP practice and trying to get through reception and make an appointment. Clearly, that functionality is fully customizable by primary care and can be disabled for whatever reason if you were inundated with messages. But I'll show you our data from our pilot. That just has not happened. You're very unlikely to be inundated with amber emails, and instead over 70% of your patients will be signposted to green, which means they're highly unlikely to then, current format is to call up the practice and then really make it challenging for reception staff to be answering many phone calls. And so, as I said, when we had piloted it in the Sovereign PCN, about almost 64% of patients, of parents who use this when they're worried about their child land on a green disposition. About 22% end up with an amber disposition, but of all of these 450, only about 25% end up actually communicating with primary care, which is a huge reduction in activity. When we reviewed these data, we reviewed all of the amber online consultations. Some of those parents still chose to call the practice at that point rather than submitting an online consultation. The majority did for the pilot because it was still early use of the app. We reviewed all of those amber online consultations. The GPs within the practice did, and they were all found to be absolutely appropriate. And I think that this is the time to onboard with the app. It's been a hugely challenging couple of years, but over the past 2 or 3 months, we have seen a significant reduction in COVID-related activity, reduced staff absence, reduced patients with COVID, and we perhaps have a window when we can start implementing things that will benefit us over the autumn when we see rates of potentially COVID but other respiratory viruses rising. Just to note that the y-axis is always greater for children than adults because children make up a significant amount of activity, and even though those bands are far tighter, they're only 1 year, 1 to 4 years, 5 to 14 years, so far fewer children. We have a far greater proportion from frequency presenting younger children than older children. But I think the concern is that the events of the past 2 years in terms of social restrictions have completely changed the dynamics of infection. So even now, the reason not to delay till the autumn is that we've even seen an uplift in rates of upper respiratory tract infections in children over the past couple of months. And I'm sure many of you are seeing children once again being brought to your practice, having had a significant period of time without that many children being brought. And I think that before we start seeing large numbers of children being brought to your practices is the time to onboard with the app. So in terms of the logistics of onboarding with the app, it's absolutely free for primary care networks or GP practices because the ICS have agreed to fund the rollout and the ongoing use of the app. There's a very straightforward online process for expressions of interest, or you can just email the app developers admin@cenigma.net, CENIGMA, who make an expression of interest for onboarding with the app. The actual process of onboarding merely takes an hour or two. It's done, and it's a very smooth process overseen by the app team. But there clearly is a process to check that when you onboard, that an email going from the app does land in the right inbox within your practice. Obviously, data protection issues have all been reviewed and have been signed off by the ICS, and there is a formal evaluation being conducted by the Wessex AHSN to evaluate the impact of system level implementation of an app such as this. In terms of getting the message out to parents, we've already developed a number of MJOG messages and AppQRX templates that we would that the app developers would just give to you, that you can just send out as a job lot to parents within your practice. You can add the template, the AppQRX template, to your system, so that if you do have a face-to-face consultation, you can send that text message directly to the parents. And we've also developed social media assets, including an animation about the app that you can put on your Facebook sites, etc. The app is going to get better. It's going to have translation functionality in the same way that the website does. It's going to enable parents to send images and videos in due course for amber children, to allow that a triage process within primary care, or that review in primary care, to be conducted more efficiently, and to identify children that really do need to be seen the same day. There's going to be improved integration with primary care systems. So at the moment, it's still slightly clunky in terms of an email coming into an inbox, but we're working on integrating that with System 1 and EMIS Web. And there will be integration with other bits of the urgent care pathway, and out of hours, that will be the NHS 111 paediatric desk, to make that journey for parents far smoother, rather than having to call up 111 and go through that very convoluted process through a call handler through to a clinical advisory service. This will make that journey, and which will also make the app far more attractive for parents. Maternity content is going to be added to the app in the next couple of months, and we're in the process of developing mental health content that will not only signpost parents to appropriate services, but will also provide them with interventions both for their children and for themselves. And we'll be developing injury guidance as well shortly. So my summary is that I do really believe it's time to start onboarding. A significant number of GP practices and PCNs have already onboarded. I think the past 2 or 3 months have been challenging in terms of the workforce in primary care, but actually, if we have a window to implement this, whilst we are now starting to see an uptick in presentations to children, and highly likely to be a significant uplift in the autumn, I'd strongly suggest that you contact the team at Sigma to onboard it. Thank you very much.